How does alcohol impact epilepsy seizures? Imagine enjoying a social drink, but unaware of how alcohol can influence your brain and seizure risk. For people with epilepsy, alcohol can be a tricky factor that affects their condition in several ways. When someone with epilepsy drinks heavily or frequently, their chances of having a seizure can increase significantly. This is especially true during the hours after they stop drinking, when withdrawal symptoms set in. During withdrawal, the brain becomes more excitable, which can trigger seizures even if none occurred while drinking. Alcohol affects the brain directly by changing how nerve cells communicate, making seizures more likely. It also causes indirect effects like dehydration, poor sleep, and blood sugar fluctuations, all of which can promote seizures. Poor sleep or tiredness is a common seizure trigger, and alcohol often disrupts sleep patterns, especially if consumed in large amounts or late at night. People with certain types of epilepsy, such as genetic generalized epilepsy, are at a higher risk of alcohol-related seizures. Studies show that heavy alcohol use can increase seizure risk by up to 9 times compared to those who do not drink heavily. Alcohol misuse is also linked to a greater risk of sudden unexpected death in epilepsy, a serious and rare complication. Some individuals with epilepsy may drink alcohol in moderation without experiencing more seizures, especially if their epilepsy is well controlled with medication. However, medical experts usually recommend caution. Binge drinking or chronic heavy drinking should be avoided because they can increase both the likelihood and severity of seizures. Alcohol can also interfere with anti-seizure medications by causing vomiting or reducing their effectiveness. Additionally, some medications can make alcohol's sedative effects stronger, which can be dangerous. In summary, alcohol impacts epilepsy by raising the risk of seizures, especially after drinking stops, due to withdrawal effects and other seizure-promoting factors like poor sleep and dehydration. It can also reduce how well medications work. People with epilepsy should talk to their healthcare providers about their alcohol use, so they can make informed choices and keep their seizures under control. Practical tips include avoiding binge drinking, monitoring sleep and hydration, and understanding personal limits. Remember, each person's situation is unique, so personalized medical advice is always the best way to stay safe.